Hi guys, welcome to another video of Live Fearless, and today here we have with us Dr. Shalini Anant. And Dr. Shalini Anant is a physiotherapist, a certified childbirth therapist and a yoga therapist, and also a founder of Aroghya Pregnancy. And I'm going to ask Doctor, what exactly is Aroghya Pregnancy about?
Aroghya pregnancy is basically a prenatal and a postnatal kind of a platform where I help women during the journey from womanhood to motherhood, as far as the emotional impacts of pregnancy, diet chart, exercises, relaxation, pelvic floor muscle training, labor breathing exercises, lactation, and newborn baby care. So that's a very
Wow.
comprehensive thing that we are basically kind of
Basically, how
into.
complicated is the woman's body, right? I mean,
Yeah, we are
so
as
many things
we are
that we
very
have to
straight
deal
as
with, right?
jalebi. We are very straight as jalebis.
No, I mean it just starts from puberty and we are here
In fact,
till
every
menopause.
part of our face is governed by a lot of hormones.
Right.
Because when you start your journey with the puberty years.
Absolutely.
Okay, which is kind of very important, where you pay attention to what you eat at that period, because that lays the foundation for the how your reproductive system is going to function later on.
Totally.
And with the current generation, I am having the girls fed on burgers, pizzas, pastas,
Absolutely.
and that's the reason we land up with issues during the fertility periods of thyroid, PCOD, PCOS, difficulty in conceiving, complications in pregnancy.
Right.
And how you take care during your fertility years, specifically more to during your pregnancy years, sets the tone how your menopause is going to be.
Absolutely.
So it is just a circle. So
Right.
we constantly need to take care of our health. And as women, we have in our to-do list house, career, family, everything else. And in the list, our name is either
At the
last,
bottom, yeah.
or sometimes
Absolutely
our
at the
name is
bottom.
not even there on the list.
Yeah, I agree. I agree. I agree.
So I think it is, this platform is nice, for women, by women.
Okay, so we are basically saying that it's not at menopause, it's not like at post 40 is that when you need to start thinking about how you're going to deal with this. You need to start thinking about it in your 20s.
When you're
So you're
14,
ready.
from 40, before
Right.
14.
So absolutely, when you're 14 is when you need to start
Yes.
being more proactive and more serious about taking care of these things, and not
Yes.
be reactive to it when you probably hit an issue with conception, or you have challenges with pregnancy, or during menopause things get difficult. So okay, that's a very interesting perspective. So if I have to come to menopause a little later, okay, and if I have to ask you, so right at the start, right from puberty, till the time a woman manages to conceive, and the post pregnancy period, what exactly are the things that you think every woman must very particularly do?
See, yes, food, your diet, because obviously your body needs kind of, a car needs petrol to run, your body needs
Absolutely.
food to basically go about. So, what you kind of put in, how dilute you make it, how healthy it is, how junk it is. So, that all sets the tone for your body function. Then the functioning part comes into the picture.
Right.
What function you are doing.
Right.
So if you're going to be kind of, just be sedentary, not do activities, okay, you're just going to be kind of, being a more on a sedentary lifestyle.
Absolutely. Yeah.
Okay. So being active, being just, I would love to use the word mindful.
And conscious of what you're doing.
Yes.
Very, very important. Okay. So now, if I have to talk about menopause, post 35, 40, I mean,
Yes.
I've started seeing Indian women have started hitting menopause a lot earlier than what we see internationally. I think
Yes.
around 50 is the age internationally. In India, I've
more
mostly
earlier.
seen around
40,
45,
yes.
46,
40.
and there are a lot of women who hit it at 40 actually.
Yes, 40.
And that's when a lot of issues start around your musculoskeletal or your bone mass and things like
Yes.
that. And typically, I mean, if you walk into a gym, you'll probably find like 5 men and 1 girl who's working out.
Girl.
I always see that.
That's a girl.
and
Not even a
most-
woman,
yes,
girl.
Most times it's a girl.
Yes.
It's not even a woman,
Okay.
and she's probably there because she wants to get leaner,
Hmm.
fit into good clothes, which is why you should go to the gym. I don't deny that. But
You look gorgeous.
yes, but the other most important thing is I'll probably land up seeing her doing more of cardio and less
Yes.
of weights,
Yes.
because there is a perception that if you
Women
are
should
weight
not.
training,
Yes.
you get bulky, which cannot happen physiologically. It cannot happen. So it's high time we get out of that mindset.
Yes.
But yeah, which brings me to a very important question: is that how does the body change, or post 35, 40, while we're getting closer to menopause, perimenopause? How does the body essentially change?
You used a very good word, perimenopause.
Right.
Menopause is actually the time where you have not had periods for 12 whole months. So you have
Absolutely.
attained menopause.
Yeah.
So that is not the problem. The problem is in that perimenopausal period, which lasts from anything from 4 years to 10 years and even to 12 years.
Right.
So it starts way before, and by the time the woman realizes that she is undergoing a perimenopausal period, she's kind of already gone through harrowing days.
Absolutely.
So identifying, the first symptoms that you are in perimenopause is very, very important. So yes,
Right.
the most commonest things that you tend to kind of, hear is yes, hot flushes, vaginal dryness. Nobody likes to talk about the vagina.
Absolutely.
It's a taboo topic.
Taboo, it's as though like women don't have vaginas, and it's not anywhere.
So yes, so
related to
today
them.
we are going to be talking about the big V, which is the vagina.
Absolutely.
Okay, so the dryness, the itchiness, the lack of lubrication, loss of libido, everything associated, which starts off way too initially. Associated with this, we have fatigue, we have got tiredness,
Insomnia. Big time.
and you are basically depressed, you are anxious,
Moody,
and moody,
irritable.
and you need to also understand that by the time the woman is 40, her kids are already entering the teen. So
Absolutely.
you have got two hormonal women in the house,
And you have aging parents.
and you have aging parents.
So deadly combination.
Yes, it is a deadly combination.
Absolutely.
So you need to understand what changes you are going through first, then you can guide your daughter through the period or your son through those periods.
Absolutely.
Okay, so identification of the said problem becomes very important. That is the reason when you are around 40, start going for your yearly annual medical visits to the gynac.
Right.
You don't have to kind of reach out to your gynac when you are having issues. General checkups. Women have never heard of general checkups. They never do general checkups.
Yes, yes. We are super women, right?
Yes.
We know to do everything.
We are
but
Wonder Woman.
We are Wonder Woman. Yeah. We want to do everything, but
Yes.
we will not fall sick.
Yes.
It's like, falling sick is like going on a vacation. You have to plan. Okay, this is the day I can probably afford to fall sick because my kid doesn't have exams, my husband is not traveling, my cook has come today. I mean, it's literally like, going all over the place.
I think we should say we kind of need to tell sickness like appointment leke aana, time nahi hai
बीमार
abhi.
पड़ेंगे. I mean, ironically,
Yes.
that's not how it should be.
Right.
Because, coming to the fact that the incidences of women having osteoporosis
Yes.
or arthritis is a lot
More,
higher
yes.
than men.
Because when you are basically kind of having your puberty time,
Right.
we basically tend to generate progesterone and estrogen, which is your female reproductive
Absolutely.
hormones.
Yeah.
Now this stops or starts reducing in the production in the perimenopausal period, and if I have to tell you, draw a parallel to Indian mythology, I would say our estrogen and progesterone is like Karna's Kavachas and Kundal. So as soon as Karna's Kavach and Kundal is what that protects him
Right.
from during the wartime. So once that Kavach and Kundal is off, he is susceptible and he's a sitting duck for everything.
Absolutely.
Same thing is with us. So as we start eroding the estrogen and progesterone in our body, we are just a sitting magnet for everything to come and hit us.
Absolutely.
So you have got to deal with cardiovascular issues, you deal with ortho issues, you deal with obviously central nervous system. So yes, emotional issues, you deal with your own reproductive issues. There are a hell lot of issues that comes into the picture.
Sure. I mean, at this point, like while we are on this topic, and since I have undergone a surgical menopause is basically
Medically.
when your ovaries have to be taken off for whatever reason. I had to do it because of endometriosis. But I realized post my surgical menopause that and I have always been physically active, even before menopause or while endometriosis was.
I just had a glimpse of it a little while ago.
Yeah, the kids, anyways, and whatever. So the thing is, but the minute I hit menopause, and I actually realized my body changed, because things that I could freely do before I hit menopause, now I can do them. And honestly, which is a very good thing, that in spite of having a surgical menopause, there are a lot of things that I can do. But there was one point in time when I could freely go for a sprint. I realized sometime a couple of months ago, I went for a sprint, all bindas, nothing has happened types, and I realized I started having knee pain, which would probably not have happened, I think, in my opinion, if I would not have been in menopause. And I think it's also greatly related to the fact that the estrogen depletion, and obviously with ovaries gone, a great deal of estrogen is missing. And you are put on HRT, which is a good option. Personally, I mean, I'm not a doctor, I shouldn't be commenting on it, but from what I've researched, from what I've spoken to women around, as bad as HRT is thought of, it isn't that bad. It's working pretty well, decently for me, and I'm not on actual HRT, not an estrogen supplement, but a substitute for it, which was prescribed by the doctor. But I think probably to a great extent my knee pain did go because of that. My knee pain also probably went because I took glucosamine supplements. I don't know exactly what it is. The minute I find out, I'm surely going to tell you guys, because I know a lot of women have this. But a very, very important thing that I need to tell you is, forget HRT, forget glucosamine. I am very sure that the pain started reducing the minute I started strengthening my quads. So,
that's where I'm going to come into the picture. We'll be kind of, teaching you all as to basic exercises, how to strengthen the quads today.
And it's very, very important. So all of you who have, issues with your knee pain, trust me, the minute I realized my quads was getting stronger, my knee pain sort of subsided. So very important, another thing, apart from maintaining a good good weight around menopause, another very important thing is that you strengthen all these, so that you are not
it's not just
putting a lot of burden on your knees.
Muscles, actually.
Yeah, all the muscles actually. But I think knee pain is
very predominant.
Very, very predominant. I mean, almost 50-60% of women post-menopause
you land up also with osteoarthritis of the knee, which kinds of flares up a big time post-menopause, and where I get to see knee replacement surgeries. I kind of rehabilitate the patients post also. But the pre-op period, they miss out on all the exercises.
Yeah, so because you don't know. Anticipate.
Yes,
right?
You don't know. And they are like, ठीक है ना, हो गए ना, अभी 50 साल के हो गए, अभी कौन एक्सरसाइज करेगा? This is the general mentality of people.
And अगर हाथ दुखने लगा तो एक दिन हाथ दुख रहा है तो तुम मतलब कुछ नहीं करोगे. You not even want to go for a walk. And that's the worst thing you can do, because you need to ensure that you continue doing something. If your legs hurting, try and do something on your upper body. If your arms are hurting, or if you've hurt something else, ensure that you go for a walk. The whole idea is to be active.
We say something like, और कोई exercise करो या ना करो, walk कम से कम करो.
Walk is
so basic, that is the best aerobic activity that you can do. Now, people who are having extreme amount of knee pain, where even taking a walking step is difficult. Swimming.
Yeah.
Okay, buoyancy will work on your body pretty good. After COVID protocols are over, we will get back to that.
I think we want to focus on three main things. We'll try and do that for this video specifically. And if there's anything additional, I want you to tell me. But three main things that I've seen most often women deal with during this phase. One is the knee pain bit of it.
Yes.
The second is the fact that you tend to lose balance very fast.
Okay.
And you tend to get prone to fractures and things
like because osteoporosis, your bones become weak.
And the third one is incontinence.
Yes.
And that's the thing that
again we come back to the word vagina.
About it.
Yes, again we come back to the word vagina.
About it. So incontinence, and I think a lot of women face incontinence post 50. So another part, back pain. Yeah, and back pain. So we are going to come to it quickly with focusing on all of these topics. And बस करो बहुत हो गया
Okay, today now we are going to kind of get into a little bit of exercises. Now, before I start demonstrating the exercises, I need you all to basically do a very good warm up. It could be just your, old PT exercises which you have never done before. So you can just kind of, do a good warm up for 10-15 minutes. Then getting to do your exercise part. Either it could be, cardio, it could be, workouts, it could be circuit, it could be functional, or it could be just about anything that you are interested in doing. It could even be Zumba, it could be aerobic activity, yoga, anything. Basically, move your body, okay? Followed by a good cool down, which is very, very important. Most of the time, we miss out on the cool down thinking, अभी घर पे जाके ये करना है, वो करना है. So, you miss out on the cool down. So, the body needs to relax after the activity so that we prevent muscle injury, we prevent muscle soreness. Okay, so now we are basically kind of going to talk about how the uterus is basically placed inside our body and what is the surrounding structures which we need to strengthen and focus. Now your uterus is not attached to any bone in the body. It is suspended inside by three nice long ligaments. Okay, now I have got, it is like if I give you a square box. So I have got in the front, I have got my abdominal muscle. Okay, at the back portion I have got my back muscles. At the lower end I have got my pelvic floor muscle, and at the top end I have got my diaphragm. Okay, so these are the structures, and inside this I have my uterus basically kind of rotating, and plus there are other organs inside. So I need to focus on strengthening these four major chunk of muscle groups when I'm going to be talking about this is the round circle that we are going to be covering today, encompassing. So that becomes your core stability exercise where I'm going to club them together. Okay, so let's getting on to it as to how to go about it. Typical back care, no lying down straight, no getting up straight, always turn to your side and lie down, turn to your side and get up. So, coming to the core stability. So this is the starting position that I'll be in. Okay, I'm going to tuck the lower abdomen inside. Okay, and then I'm basically going to be breathing in from my nose, and while breathing out I'm going to be breathing out from my mouth. Okay, and at the same time I'm going to raise my lower abdomen in. Okay, so relax down, tummy tuck. So this is something that you can repeat for 10 counts. If this is difficult for you all to understand, something more simpler, you can basically place your hands on your knees, stay in starting position, tuck your tummy in, breathe in, and push out. So this will work at the lower abs as well as at the back. So this works at both the places. Okay. Next, what we can basically also work on is when I'm breathing out, I'm also using the diaphragmatic muscles. Also, I am basically, when I'm tucking in the tummy, the core muscles or my pelvic floor muscle is also basically getting engaged. So this finishes the box exercise. The next exercise that we like to basically focus on is our knee that we spoke about in the session. So now in this exercise, I need you to basically just tighten the knee, release, tighten the knee, release, tighten the knee, release. So this is very basic. I think I can sit and also demonstrate this. Okay. So what you can do is you can basically sideways lean. So I can basically place a towel or a cushion. Okay, I'm just placing my hand so that you understand and appreciate the movement. So I'm just tightening the knee, releasing, pressing the knee down, releasing. So this is static quads that we tend to call. Same thing, you can basically place a roll of a towel below your ankle, and this you need to press. So this is static hams. You'll feel a stretch which is coming or a pull which is coming on your thumb. So these are all isometrics, basic exercises where people who have never exercised before and they are kick-starting. So these are basic ones that you can start with. Okay. The other one that we can get going to do is just heel slides. This is something that we can do. Okay. Another one that we can actually do is You can get into half butterfly. People basically kind of, doing full butterfly. People all kind of talk about full butterfly. But if that is difficult, we can start with first basic, half butterfly. How much ever you're able to make figure 4, get to that particular position. And then slowly oscillate. Mild oscillation. How much ever you can do, around 20 to 30 counts, slow oscillations. So this will also basically kind of relax the knee joint. So this is something that we can do. Okay. Once you've done these basic exercises and achieved a little bit of mobility and range of motion, we can basically then get going into dynamic exercises where we are going to be using resistant bands, we can use thera bands, we can use weight cups, and we can start with weight training. But initially, I don't want you all to basically start with strength training with pain. Gradually ease into it, okay? And yes, catch hold of a therapist, okay, who will guide you through the right way of exercising, because everybody is unique and different. Okay. Next, we are going to come to the big V or the vagina, or we are going to talk about stress incontinence. Now, so going on with some knee exercises. First, we are basically going to do static quads. So you can basically use a roll of a towel or a cushion, okay, below your knee, and you just need to basically press the knee down on that said towel. You can see I'm basically contracting my quadriceps. Okay, to show a better way of movement, I can just basically keep my finger down, but don't make your fist of your palm. Use a towel. So this is something that you can do. Same thing can be done, okay, below your ankle. Okay, so this is for your hams. The next that you can actually do is heel slides. So just bending the knee and straightening it out. To as much as capacity, you can actually do this. Proceeding it further, you can basically kind of get going to do first half butterfly. So sit straight, make a figure 4 with your ankle, and just do gentle oscillations. You can do it, and post these basic exercises, you can then basically progress to strength training, where you can basically make use of thera bands, thera loops. You can make use of weight cups, and then you can basically start going to do dynamic quads and working on your hams. You can do lunges, squats. So this will basically take care of your knee. Now, when you're talking of incontinence, now what you mean by incontinence is your bladder control basically kind of gives way. So maybe when you sneeze, when you cough, when you laugh out loud, you have a little bit of leakage of your urine into your panties, which is slightly awkward, socially embarrassing issues, and we don't talk about it. This can be easily rectified by basically strengthening the sphincter muscles that has just lost control. So the muscle has become weak. It's as simple as that. So how do I strengthen the muscle? Now, even when I'm just seated this way, I just need you to basically kind of contract your vaginal area and release it out. Contract and relax out. Okay? Just like maybe you just want to kind of use the washroom, and we don't have a washroom available. What do? We just kind of pull it, right? That's exactly what I want. So just pull in the area, relax. Pull in the area, relax. Once you're comfortable doing this, we can then go to resistance training. So this is washroom exercise, which we call it as start-stop method in Kegels. So I need you to basically start with the flow of your pee. Go for some time. Okay, I need you to hold the pee. Okay, continue to breathe, and I need you to count 5. After some time, again start, go for some time, again hold, count 5. Start again, go for some time, again hold, count 5. Again start. To basically kind of do 3 to 5 rounds, each time holding for 5 counts. Now initially when you're going to start this off, maybe after the second count or the third count, you can have a little bit of pee dribbling. It's okay. It's absolutely fine. You just have a weak musculature. Continue practicing on an everyday basis. Gradually over the weeks, you would see an improvement while doing this. And next, Next, a little bit of back care. Now, 90% of the women have low back pain, and most of the times it is psychosomatic. We are kind of, emotionally disturbed, or we are basically having our mood swings. So usually it tends to kind of, physically manifest as back pain. So something to basically kind of help you relax the back muscle, stretch it, and strengthen it is something that we will learn today. Okay, so going on to the side and lying down straight this way. Now this is static back. I need you to press the head, shoulder, palm, knees, and ankle all together on the ground together. 1, 2, 3, 4, 5, and release. Again press. 1, 2, 3, 4, 5. Release. Again press. 1, 2, 3, 4, 5, and release. So once this is static back, very basic. The next what we can do is we can do bridging. So in this, I need you to basically bend your legs at the knees and then gradually lift your hips up. So as much as possible, hold the position. While dropping down, I need you to basically do an elevator one. So we first drop down the upper back, followed by the middle back, then the low back, lastly the butt. Doing static back exercise, I need you to press the head, shoulder, butt, palm, knees, ankle all together on the ground. So going press 1, 2, 3, 4, 5, release. Press 1, 2, 3, 4, 5, release. Press 1, 2, 3, 4, 5, and release. The next we are basically going to do back extensions, progressing further. So in this, the first basic thing is just coming up, only so much, and going down. The next thing is basically progressing it up and coming up on your elbow. This is the space pose. Once you're comfortable doing this, and then you can progress to complete with elbow extension.
Okay, so I hope all the exercises that Dr. Shalini has shown are going to be useful to you. And if you want to reach out to Dr. Shalini, I'm going to share her details down here below the video, but you can also reach out to her at arogyapregnancy.in. You will find her contact details and details of all the help that she can do to you. And finally, Dr. Shalini, thank you so much for
It was
giving
a
us this
pleasure.
time
It was a
and
pleasure
being
being
on
here.
this show.
It was a pleasure.
Thanks
It was
a
a
lot.
pleasure.
Bye bye.